had created the perfect baby. The operation was a success, or so I had thought, until the lightning revived my creation. Upon rebirth, my little monster was cyanotic, groggy, and had a heart murmur. I took my newly conceived ultrasound machine and peeked inside the baby's chest. Behold! The pulmonary artery was coming off the left ventricle while the aorta came off the right instead of the other way around. Classic transposition of the great vessels, the most common cyanotic congenital cardiac anomaly and the second most common congenital heart defect. I had fashioned a monster! Blue blood was returning from the body from the right side of the heart and then pumped from the right ventricle back into the body. No oxygen reintroduced back into the blood! Meanwhile, red blood returning from the lungs from the left side was pumped from the left ventricle back out to the lungs! What a horrific scene! I placed my creation on an IV breathing tube, measured its oxygen level, and monitored the heart with my echocardiogram machine. What had caused my creature to have TGA? Had the mother been diabetic? Infected with rubella? Had she imbibed, smoked, or ate poorly? Did my creation grow in utero with trisomy 21? I would save genetic testing for another day. It was now time to save my monster from baby blue syndrome. I knew with my expert hands that I could perform surgery to fix what ailed it. I would execute the classic arterial switch perfected by my colleagues some 30 years ago. But what cardiac defect did my monster have that would allow it enough oxygen to sustain life for the time being? There was the beloved patent foramen ovale, a hole located between the two atria that usually remains open after birth, which would allow the red blood from the lungs to cross from the left atrium to the right and then mix with the blue blood. Or the patent ductus arteriosus, connecting the aorta and pulmonary arteries, a hole that typically closes after birth that then requires prostaglandins to keep it open. But, being that my beast was reborn, the medication would not be beneficial since the PDA had already closed. On top of that, the PFO was too small and would not allow the blood to mix. Alas, neither would do. I would instead approach my chore with either the arterial septal defect or the ventricular septal defect. The ASD located in the upper two chambers would work. If my monster has ostium secundum ASD, the most common ASD defect located in the middle of the arterial septum, I could perform surgery. I checked the symptoms and causes of ASD, examining my creature with a plethora of newfangled tests: echo, EKG, chest x-ray, pulse oximetry. After all this, it did not have an ASD. At least I could avoid the post-operative risk of pulmonary hypertension or Eisenmenger syndrome. Now, my last resort, VSD. A hole located between the two ventricles could work. Performing an echo, I could see my creature did indeed have a membranous VSD and not a muscular, nor inlet, nor outlet VSD, the rarest form of all. Along with my sonographic findings and the presence of a heart murmur, I knew for sure my monster had VSD, thus could be saved until the surgery could be performed. A few days later, I began my arterial switch procedure. I cut above the valves, leaving behind a small portion of the valve and blood vessel for reattachment. I then sewed the aorta onto the left ventricle and the pulmonary artery onto the right ventricle, remembering to reconnect the coronary arteries to the aorta so blood could be carried to the heart muscles. Mein Gut! Perfection!
Life! Life, do you hear me? Give my creation life!
With a healthy dose of digoxin to strengthen the heart muscles, diuretics to help remove excess fluid from the body, ACE inhibitors to lower my creature's blood pressure, and a nasogastric tube to provide proper nutrition, my monster will now live a long, healthy life! To verify its future viability, I will employ my associate cardiologist to monitor my beast's health. I will continue to perform innovative echo exams, stress tests, and cardiac MRIs to ensure the surgical success and to make sure there are no arrhythmias, muscle weakness, or leaky valves to put my monster at risk. Dr. FrankenScan, you've done it again!